Atrial fibrillation treatment in Waco TX. Atrial fibrillation is an irregular and very rapid heart rhythm that may lead to blood clots in the heart. With atrial fibrillation, the heart quivers, skip beats or beats irregularly. Atrial fibrillation increases the risk of heart failure, stroke and other heart-related issues. About 2.6 million Americans are living with atrial fibrillation. During atrial fibrillation, the artery beats irregularly and chaotically. Many people think atrial fibrillation has no symptoms. However, atrial fibrillation may cause a fast pounding heartbeat, weakness or shortness of breath. Causes of atrial fibrillation. To understand the causes of atrial fibrillation, it may be helpful to understand how the heart typically beats. Problems with the heart structure are mostly the cause of atrial fibrillation. Common causes of atrial fibrillation include first, high blood pressure, second, sleep apnea, third, heart attack, fourth, heart valve problems, fifth, coronary artery diseases, sixth, viral infections, seventh, physical stress as a result of surgery, pneumonia or other illnesses, eighth, previous heart surgery, ninth, thyroid diseases such as an overactive thyroid, 10th, lung diseases. Symptoms of atrial fibrillation. Sometimes atrial fibrillation symptoms come and go, usually lasting for about 30 minutes to some hours. Some people having atrial fibrillation don't notice any symptoms at first. Sometimes the symptoms may come. First, chest pain, second, shortness of breath, third, sensations of a fast fluttering or pounding heartbeat, fourth, weakness, fifth, dizziness, sixth, fatigue, seventh, reduced ability to exercise, eighth, lightheadedness. Treatment of atrial fibrillation. Treatments such as surgery, non-surgical procedures and medications can slow the heartbeat and bring it back to a normal rhythm. Below are some treatment measures. First, blood thinners. These particular medications thin the blood to lower your chance of having those problems. But they can cause bruises and increase your risk of bleeding. So you may have to cut back on some activities that can lead to injuries. Second, heart rate medicines. Drugs that control the heartbeat are the most common way to treat atrial fibrillation. It slows your rapid heart rate so the heart can pump blood the normal way. Some are known as beta blockers. Third, heart rhythm medicines. They slow the electrical signals to restore your heartbeat to what is known as a normal sinus rhythm. These treatments are called chemical cardioversion. Risk of having atrial fibrillation. Things that can increase the risk of atrial fibrillation are as follows. First, age. The older a person becomes, the greater the chances of developing atrial fibrillation. Second, heart disease. People with heart disease such as coronary artery disease, congestive heart failure, heart valve problems, congenital heart disease, or a history of heart attack or heart surgery have more chances of atrial fibrillation. Third, drinking alcohol. Drinking alcohol can trigger an episode of atrial fibrillation for some people. Fourth, high blood pressure. Having high blood pressure, especially if it is not properly controlled with changing of lifestyle or medications, can increase the risk of atrial fibrillation. Fifth, thyroid disease. In some people, thyroid problems may increase their heart rhythm problems, including atrial fibrillation. Prevention of atrial fibrillation. Healthy lifestyle choices can help reduce the risk of heart disease and can prevent atrial fibrillation. Below are some basic heart healthy tips. First, avoid or limit the intake of alcohol and caffeine. Second, don't smoke. Third, get regular exercise. Fourth, maintain a healthy weight. Fifth, manage stress, cause intense stress and anger can cause heart rhythm problems. Sixth, eat a nutritious diet. What is the best way to treat atrial fibrillation? Heart rate controlling medicines like beta blockers that include low pressure and topol and correct are the best way for atrial fibrillation treatment. These medications can control or slow the rapid heart rate so that the heart can pump and function normally. If you want more details, please do watch www.lonestarheartandwellness.com.